I received a Facebook message from Tara in Georgia asking about what I do post-transplant to be compliant. Well, Tara, just like having cystic fibrosis before transplant, there are certain things that I have to do on a daily basis. First, I do keep a log of the following things. I have to test my oxygen saturation, my blood pressure, my heart rate, my temperature, spirometry, which includes my FVCs, my FEVs, and my PEFs. I also test my blood. This is done on a daily basis, including taking all of my medications, which of course include the anti-rejection drugs, which are taken twice a day. On average, I probably take 40 pills a day. I keep a record of this daily because it's a good way to monitor how my lungs are doing. So if there's any drastic changes in temperature or my spirometry, I do have to notify the doctor. It may be a little old school to write everything down in my book, but the good thing is my spirometer is digital and I can upload all of my data there and email it to my doctor. Spirometry is probably one of the single most important things post-transplant that keeps you in check of how your lungs are doing. I have a pill tray and it's marked for each day, and I take pills 4 times a day. I take them in the morning, at noon, in the evening with dinner, and I also take them at bedtime. The anti-rejection drugs are taken at usually 9 a.m. and also at 9 p.m. I also have a pulse oximeter, so I test my oxygen saturation on a daily basis, and it's basically pretty simple. I stick my finger in the oximeter and it gives me a reading of my oxygen saturation and my heart rate. To check my blood pressure, I use the wrist cuff, which is pretty simple and pretty compact. It's very important to hold your wrist close to your heart so you get a proper reading. Checking my temperature on a daily basis is really important also because it does show signs of any changes or a possible infection. It's also important to test your temperature on a daily basis to make sure that there's no changes or signs of infection. I use the ear digital thermometer because it's quick, simple, and very accurate. Also, due to diabetes, I do need to check my blood usually 3 or 4 times a day. I check it every morning when I wake up, before meals, and then usually a couple of hours after each meal to make sure it's in check, but also, depending on my blood sugars, I do have to take insulin. To check my blood, I first have to clean my finger with an alcohol pad. I prep it a little bit by pushing on the finger to make sure the blood is gathered in the tip of my finger. Then I prick it. After I prick my finger, I put the blood on the strip and the machine will tell me what my blood sugars are at. Depending on where my blood sugars are at, that'll give me an indication of how much insulin I do need to take. People wonder if it hurts when I prick my finger. To be honest with you, it really doesn't hurt at all. It's a little stick and it stops bleeding as soon as you put the alcohol pad back on it to clean it off. Doing spirometry on a daily basis is a bit of an effort, but to be honest with you, I enjoy it because it's my way of really testing myself to see where my lung function is at. So yes, Tara, there are some things that I do need to do post-transplant, but to be quite honest with you, it takes only about 5 or 6 minutes, and it's nothing compared to what I did pre-transplant with cystic fibrosis. And these little things that I have to do are extremely important to maintaining my health and preserving my lungs. So this gives you a little insight into my daily routine post-transplant. And just remember, it's really important to stay disciplined.
Got questions for Jerry? Send them to us. When Jerry answers your question, we'll credit you for it. So get busy and send them in. Nothing within the CF Windsprint video series should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Jerry Cahill, and contributors to the CF Winsprints video series cannot be held responsible for any damage which may result from using the information on this video without permission of your medical doctor.